Well, good morning to you all on Tuesday the 28th of August. The polls have Kevin Rudd phenomenally in the ascendant, and it seems as though, at least at this stage, the public are not much interested in policy or where a change of government is likely to take us. An industrial relations policy which yields significant ground to the union movement ought to be enough to create concern for everybody, given that independent analysts have already warned what such a policy will do to jobs, interest rates and growth. Kevin Rudd is obviously aware of this, and while he seems at this stage unprepared to confront the unions and change the policy, he's making gestures. He's now saying that he agrees with John Howard's tough limits on unions entering work sites, and this is meant to make his party business friendly. This is a bit like the hospital policy, which I'll come to in a moment. Restrictions on union access to work sites was introduced under the Work Choices legislation. That's the legislation Kevin Rudd says he'll rip up, and these restrictions are now going to be kept. Kevin Rudd agrees with John Howard. I'm not sure that Julia Gillard does, but it doesn't alter the fact that the industrial relations policy would return Australian workplaces to a fairly dark past. And if that sounds alarmist, so be it. You can only go on the policy that's being articulated. But in the last couple of days, much has been made of the so-called Rudd initiative to make hospitals more efficient. If it weren't so laughable, you'd have to take it seriously. $2 billion over 4 years, with the possibility of taking over the running of the hospitals after the 2010 election. But it was only a week or so ago that Kevin Rudd was accusing John Howard of smashing federalism because John Howard came to the aid of one Tasmanian hospital. But Kevin Rudd's talking about benchmarking in hospitals and spending to increase efficiency. It bears no relationship to reality and makes you wonder whether Kevin Rudd understands anything about the hospital problem. Bob Carr and Maurice Yemmer have spent nearly $4 billion in this state, New South Wales, in the last 10 years on hospital infrastructure. What have we got to show for it? Chaos. Why? Well, it's the system that's at fault, not the doctors or the nurses or the emergency departments. While ever healthcare is ostensibly for free, you'll never meet the demand. Not one syllable of what Kevin Rudd has said about improved efficiencies provides one more bed or one more doctor. Hospital staff aren't running around deliberately being inefficient. They simply don't have the resources to do the job and never will, while people who should be paying for their own health care are clogging up public hospitals. We've got the shameful affair of the death of little Vanessa Anderson. 2 years ago, after being hit in the head with a golf ball at the Asquith Golf Club, she would have been 18 in a couple of weeks. And the parents still don't have the results of a coronial inquiry into her death. But evidence has been given that a doctor made a mistake, misread Vanessa's medication chart. Is it the doctor's fault? Well, late evidence was given by Dr. Stephen Barrett, an anaesthetist at Royal North Shore Hospital, the supervisor of training for the doctor in question. Now, in Mr. Rudd's grand plan, supported by media headlines, what would he say to this? Because Dr. Barrett has written to the coroner about the doctor who misread Vanessa's medication chart, which may well be the reason Vanessa is not alive. Dr. Barrett wrote of the doctor, she was paid for by the Saudi government. Our hospital paid her on call only. She didn't undergo any selection or appointment process, and our role is to train her so she could take up a consultant position at a Saudi university hospital. He said her training was modestly prolonged and would not have met requirements for local trainees. But then this, before you start imagining that Kevin Rudd will solve the problem, or is it just a mirage like the tinkering with his industrial relations policy? Because Dr. Barrett wrote, this is the guts of the issue, quote, the position that Dr. Ismail, that's the doctor in question, is in, is not unusual in the public hospital system. There are many others like her. Remember, she was paid for by a foreign government, the Saudi Arabian government. Dr. Barrett said, there are many others like her in the public hospital system. In fact, a few months before the Vanessa Anderson incident, a bureaucrat from the Department of Health came pleading with us to take more of these trainees. Clearly, there's an enormous managerial advantage to these self-funded positions. So there you are. Doctors in the system who don't undergo any selection or appointment process, paid for by overseas governments. We've recently had the Dr. Hanif case on the Gold Coast. 40% of our doctors are from overseas. Not one syllable from Kevin Rudd this week has provided for one more doctor or one more bed. But he's going to spend $2 billion over 4 years to make hospitals more efficient. It's a complete hoax. And until Kevin Rudd and his team do some more homework, policies like this are, in my view, absolutely meaningless. I'm Alan Jones.